Hello, everyone. Today I will be discussing professional accountability when caring for families after the death of a child in the emergency department. Although pediatric deaths are relatively uncommon, they are some of the most emotional, difficult situations emergency nurses will encounter. During these events, nurses have responsibilities that go beyond providing medical care. They must advocate for the child and family, practice eth- ethically and legally, support equitable care, and contribute to quality improvement within their organization. By the end of this presentation, you should be able to recognize the unique challenges associated with pediatric death in the emergency department. Identify three evidence-based assessment tools that support emergency nursing practice. Explain how nurses advocate for patients and families using ethical and legal principles. Describe the importance of social justice during end-of-life care and understand how these practices improve the quality of healthcare. The death of a child is one of the most devastating experiences a family can face. Families often remember the actions and words of the healthcare team for the rest of their lives. Emergency nurses are usually the providers who spend the most time with families during these situations, making compassionate communication and emotional support extremely important. Research has shown that families who receive clear communication, honest information, and emotional support often cope better during the grieving process. Standardized approaches also improve patient safety, reduce confusion among staff, and provide more consistent bereavement care. So, this is the why this matters. I wanted to share this. I know a lot of people are going to listen to this and be like, he talks about this situation with his son a lot. This is a photo of my son right before he was life flighted to Portland to take care of a GI bleed. Without those nurses and the team that was there, who knows where my son would be today. But I will say that it was the first time in my life that I've seen crazy amounts of speed and teamwork within an emergency department when taking care of a child. My son, we got there probably around 7:30 in the morning, and he was life flighted by 9:30 in the morning. That means aircraft landing on his way. Um, this is why it matters to me. This is why I chose to talk about this subject is because the children in our lives matter. And I understand that any death within the emergency department is difficult, but having a death within of a child can be that much harder. The first evidence-based assessment tool is the Pediatric Glasgow Coma Scale, or PGCS. This tool evaluates a child's neurological status by assessing eye-opening verbal responses and motor response while accounting for development differences between children and adults. In the emergency department, this tool helps identify children who are experiencing neurological deterioration and allows providers to recognize worsening conditions quickly. It also provides a standardized method for communicating patient status between healthcare professionals. Using the PGCS promotes timely intervention and supports accurate clinical decision making. The second assessment tool is the Pediatric Assessment Triangle, commonly called the PAT. This is a rapid assessment completed within seconds without the need of any equipment. The PAT evaluates three components: appearance, work of breathing, and circulation to the skin. By observing these areas, nurses can quickly determine whether a child is stable or critically ill. Because the Pediatric Assessment Triangle is simple and fast, it allows emergency nurses to recognize life-threatening conditions immediately and begin treatment without unnecessary delays. The third assessment tool is a Pediatric Early Warning Score, or PEWS. The scoring system evaluates behavior, cardiovascular status, and respiratory status to identify early signs of clinical deterioration. PEWS has been shown to improve patient outcomes by identifying subtle changes before a child experiences respiratory failure or cardiac arrest. This also improves communication between nurses and providers because everyone is using the same objective scoring system. Early recognition allows interventions to begin sooner and may prevent further decline. Professional accountability requires nurses to advocate for both the child and the family during these difficult situations. Ethically, nurses must provide compassionate, family-centered care while respecting the family's beliefs, cultural values, and religious practices. Honest communication and respect for patient dignity remain essential even after death. Legally, nurses must accurately document events, follow hospital policies, protect patient confidentiality, preserve evidence if abuse is suspected, and comply with reporting requirements involving the medical examiner or donation donation organizations. Following these responsibilities protects the patient, the family, and the healthcare team while maintaining professional standards. Social justice means ensuring every family receives respectful and equitable care regardless of their race, ethnicity, language, religion, financial status, gender identity, or insurance coverage. Emergency nurses should advocate for interpreter services when language barriers exist and make reasonable accommodations for cultural or religious practices whenever possible. Families experiencing the death of a child are already facing tremendous emotional distress. Eliminating barriers to communication and providing equitable care helps reduce healthcare disparities while ensuring every family is treated with compassion and dignity. Quality improvement focuses on creating systems that consistently provide safe, compassionate care. Examples include using standardized bereavement protocols, allowing family presence during resuscitation when appropriate, conducting staff debriefings after pediatric deaths, using evidence-based assessment tools consistently, and providing ongoing simulation training for emergency nurses. These practices improve communication, reduce medical errors, increase family satisfaction, and support the emotional well-being of healthcare providers. Quality improvement benefits not only individual patients, but also the healthcare system as a whole. In closing, emergency nurses have an important responsibility when caring for families after the death of a child. Using evidence-based assessment tools helps identify deterioration early and supports sound clinical decisions. Ethical and legal advocacy ensures families receive compassionate, respectful, and professional care. Promoting social justice helps eliminate disparities and ensures every family receives equal treatment. Equal treatment. Finally, participating in quality improvement initiatives strengthens emergency care and improves outcomes for future patients and families. Thank you for your time. I would be happy to answer any questions you may have. And these are the references that I used to complete this presentation.